Hello, Dr. Drake. Hello, Samir. It's nice to see you. Thanks for meeting me here to answer some questions I have for you. I'm interested in microchips and know you use them in your work as a doctor. I'm wondering though what microchips are and how they work? Yes. I use microchip technology in my work every day. A microchip can also be called a chip, a computer chip, or even an integrated circuit. They are chips placed on a flat piece of silicon. Silicon wafers are made using silica sand. They melt this sand and then put it in a really large cast called an ingot. After this, they slice this large cast into really small and thin wafers. There are transistors on this chip, and they are like switches that turn the electrical current on and then off again. The reason we use silicon is that it makes a good conductor. You can increase the conductivity by adding phosphorus or boron. Microchips are the size of your fingernail and have billions of transistors on them. There are different kinds of chips like logic chips that are the brains of electronic devices. We also use memory chips because they store all the information we need on them. Because of computer chips, we have been able to miniaturize computers and other devices. In 1971, they were able for the first time to place a computer totally on a microchip. That's fascinating. But who first created this technology? Well, there were two people who were pioneers of this technology. They were independent of each other though. The first person was Robert Noyce. He was born in 1927 and died in 1990. He was an engineer in the United States. The second person was Jack Kilby. He was born in 1923. He was also an engineer in the United States. So you said you used microchips in your work every day. Can you tell me what kind of medical devices have microchips? Well, we use microchips called semiconductors in many medical devices. They are what we call the brains in our devices. They give us user input, show displays, they process information, give us storage, and they are also in a lot of our equipment and life-saving devices. I'll give you a few examples of how we use them. We use them in portable ultrasound devices. These help us identify health problems in a patient that we couldn't see without this device. We can see things like a patient's lungs and their other internal organs and see if there is damage there. Ventilators also use microchips. The whole system uses a semiconductor chip. The ventilator has sensors and processors and can watch a patient's vital signs. It can adjust automatically to what the patient needs and adjust the oxygen levels because of the microchips. There are also semiconductor medical instruments that help with testing patients. One example is temperature screening. Right now this is important during COVID-19. We can get very quick temperature checks at the hospital and even at people's workplaces. A very helpful way microchips are used too is with wearable medical devices. An example is wearable insulin pumps for people who have diabetes. This works when someone with diabetes puts a sensor on their skin. The device reads this and gives the person the insulin they need. This could save a person's life. There are many more devices we use microchips in, such as portable ultrasound devices, ventilators and nebulizers, positron emission tomography equipment, X-ray equipment, tablets for doctors and patients for isolation communication, pictures archiving communication systems, capnography, clinical review displays, disinfection robots, drugs delivery devices, electronic beds, infusion pumps, patient monitors, RFID for patients and inventory, telepresence and therapy robots, vital sign monitors, and more. Wow, I didn't realize that there were so many things that used microchips just in your area of work. Yes, microchips have helped us save so many lives and make our jobs much better. I see how helpful a microchip can be, but doesn't it cost a lot of money to make them and get the devices that use them? There is quite a cost to new technology. For instance, microchipping humans with implantable or radio frequency identification would cost up to $300 per person. Another example is an ultrasound machine. They can cost a low of $20,000 and go up to $75,000. Wow, that's a lot of money. You just mentioned microchipping humans so you could identify them. Why do some people think this is not a good idea? You are right. There are some concerns with microchipping our patients. One big problem that is worrying people is that they won't have as much privacy. A person with a microchip could be tracked. Everywhere they go could be followed, and even things like their finances could be traced. personal information about the patient could be hacked or even sold to another party. People are also worried about where their information could be stored and who could be able to get at that information. Another big worry is microchipped humans could have some health problems because of the chip. The radiation from things like microwaves and magnetic fields could cause them health problems. I can understand how people would be worried about that. Something else I was wondering was how the manufacturing places can keep up with all the microchips you need. You know, there are shortages sometimes for this technology. This past November I read in the New York Times that there were 50% more demands for this product than they were able to provide. They had to cancel orders. This is a $500 billion industry. In September, the Advanced Medical Technology Association also said that there was huge shortage for this technology. They are working on strategies to build up their supply chains. Well, thank you, Doctor, for answering some of my questions. It was really interesting. I enjoyed it. Let me know if you have any more questions, and we could meet up again for a chat.
Have his face like really no one else got this and like have his face like really no one else got this and like have his face like really no one else got this and like